Hello everyone and welcome to the Bronki Boosters podcast. It's a series where we invite healthcare specialists to come and speak to us about asthma. We'll discuss topics such as what causes an asthma attack and how to manage it, myths and facts about asthma, and many more. Asthma is an undiagnosed and undertreated public health problem. Learn how to manage your or your children's asthma. On today's show, we chat to Dr. Carla. Doctor, thanks for joining us. We're talking asthma attacks, what causes them, what triggers them, and of course how to manage them. Let's start with the triggers. What triggers an asthma attack?
So there's numerous triggers that we get.
Yes.
First of all, the most common trigger is the common cold.
Okay.
So ironically, in little kiddies, the mom comes to my office and says, oh, this kid gets a chest infection every time he gets a cold.
Right.
And if this is a repetitive thing, then we realize, listen, this is something else.
Sure.
It could be asthma.
Yes.
People think you get asthma and you have to wheeze, but it's not true. Okay. When you wheeze, it's severe, but in little kiddies, it's a cough.
Yes.
So common cold. Then if you're unfortunate, you might be allergic.
Okay.
So it could be your pet allergy, it could be mold, it could be dust. If you have smokers in the family, the mom and dad smokes. They say, yes, we don't smoke in the house, but let's be honest,
Passive
it's not
smoking.
always that easy.
True.
Especially in the winter when it gets cold.
Yes.
So smoking is definitely a trigger. Sometimes you are unfortunate and exercise can be a trigger.
Wow.
So you get the adolescent child or the young, it's about 7, 8 years old.
Yes.
And they go and they do their soccer or they go and play their rugby or something. Colder air in the winter, bam, asthma attack.
Wow.
So it can be temperature related, it can be sports related.
Yes.
And then unfortunately also our environmental pollution and smokes.
Yes.
Our rural community, when they have the paraffin stoves in the squatter camps, can definitely play a big role and also cause extra issues. So it depends on your environment and what your triggers is. There's not one trigger for everybody.
Got you.
You have to individualize and you have to teach the parents about it.
Okay. Now from triggers we move on to worsening asthma versus an asthma attack.
Yes.
Explain the difference between the two and how would we kind of pick up on which one's which?
So a worsening asthma is where the mom would come and say, doctor, initially he did so well, he didn't get sick anymore, he was healthy, but now we're 6 months, a year down the line, and suddenly this is happening again.
Gotcha.
So we remember kids grow.
Yes.
You have to adjust the dosages. You have to make sure they still know how to use their medication. They take shortcuts. Listen, the boys.
Kids are kids.
Yeah,
that's
exactly.
Kids.
And especially the boys. No offense, but men, eh?
Yeah, exactly.
So the kids take shortcuts.
And they lie. Kids, by habit. I did do that, mommy. I did. But did you really do that?
The teenagers, that's the tough one. They don't want asthma.
Yes.
So they don't take the treatment, and it's actually a vicious cycle.
Oh.
So worsening asthma is at night they're coughing.
Yeah.
They doing their sports. Suddenly now they have to stop.
Sure.
They can't keep up with their full training period. During a match, they have to stop halftime. They can't actually go on.
Yeah.
They need to use a reliever more often than not, because the reliever puff is our guide.
Got you.
The more you need your puff, the more you need to think something's wrong. And if that's the issue, your asthma is worsening or not under control, we call it. Okay. So under control is when you are on your maintenance treatment, you use it every day, maybe twice a day, maybe once a day, but that's all you need.
Got you.
Nothing else.
Okay.
Then your asthma is good.
Yes.
So then we get to asthma attack.
Oh.
Asthma attack in little kiddies, in my opinion, I don't see it a lot.
Okay.
But it's difficult to distinguish in the little kids.
Okay.
But when you get to your adolescent children, your even young adults, if we want to call it that, you will get the patient where, bam, closes up, uses the puff, does not give them relief. They phone the emergency room or they get the ambulance in. They have to give them nebulizations. Even with the nebulizations, sometimes, if you're very unfortunate, it doesn't help and you have to go to ICU. It can be quite severe. People still die from asthma.
Yes.
It's still a reality.
Yes.
There was a short while ago, I think not a short while, 2 years ago, a well-known swimmer, long-distance swimmer, who did the Robben Island crossing. He died from his asthma. It's still a reality.
Yeah.
And in my opinion, you need to educate your patients to make sure they understand the difference.
Got you.
And they need to come already when your asthma is not controlled or worsening asthma, because that will lead to an asthma attack.
Yes.
And we want to prevent the asthma attacks.
Now, speaking of the prevention, an action plan in place.
Yes.
From the word go. It's important. It's crucial.
Yes. So 3 things. Either you do well.
Yes.
Either your asthma is worsening.
Yes.
Or you're struggling with attacks.
Got you.
So we need to get to prevent the attacks. So first of all, maintain your triggers.
Yes.
Make sure if you have a dog allergy that your dog is either not with you anymore, which is very hard.
Shame.
Unfortunately, sometimes
you don't wish that upon your dogs, but
no, and we might have to call that shot, but
absolutely.
it's tough.
Yeah.
But make sure the dog's outside at least,
Yes.
and you're on your antihistamines, you're treating your nose, and you're taking your puffs.
Yes.
If you have house dust mite, manage the house dust mite. If you are smokers, stop smoking. Okay, not smoke outside, stop smoking. Okay. If you are a person with exercise symptoms, sometimes that's tough because then we need to make sure your maintenance is actually good.
Yes.
Because that's going to make your exercise symptoms less of a problem.
Okay.
Okay. So manage your triggers.
Yes.
Okay. In your action plan, what do you do when you feel that your symptoms are worse? You're having night symptoms, you're having exercise symptoms, you feel the need to use your reliever more often.
Yes.
Phone the doctor.
Got you.
See the doctor.
Yes.
Let's reassess you.
Yes.
Maybe you've grown 2 centimeters in a month, and we need to adjust your dose.
Got you.
Maybe you're not doing your medication like you should.
Got you.
So we have certain plans. Certain doctors have certain action plans that they use. Some people are fortunate; they have what we call a peak flow.
Okay.
So we can work out according to your height, your peak flow.
Yeah.
Your peak flow, if you're well, should be 80% of what you normally would have.
Right.
Now, when you're struggling with your control, it will be less than that.
Oh, wow.
If you have a severe asthma attack, it's less than 50%.
Wow.
So you can use a peak flow meter to guide you.
Yes.
But a peak flow meter is not always there for patients or available, quite frankly. So I have like a little plan that I write for my patients, a little love letter, I call it.
Stunning.
And in that plan, I guide them on what to do. And I usually write in there, make sure after these amount of episodes or this few days, if it doesn't improve, phone me. So you need your action plan and you need to actually ask for it.
I love it. It's always nice being educated and informed. Children tell your parents, parents tell your children. If you know people with asthma, hopefully opening the world to you to discover what asthma patients deal with on a daily basis. A couple of crucial things we take away from this as well is that also never leave to go anywhere without your reliever.
Yes.
Cannot stress how important the reliever is and that action plan in place. Doctor, thank you so much for your time.
Pleasure.
And your very, very insightful look at some of the key aspects surrounding asthma.
Glad I could help.
Thank you. Thanks so much for watching today's episode. Pop your questions in the comments section below. Also remember to visit bronkiboosters.com to view all the videos, learn more about asthma, play the game, or download the comic book.